Thank you, Deputy Speaker, and I'm very pleased to speak in support of the motion moved by the member for Grey, my co-chair of the Parliamentary Enemies of Diabetes. And whilst people outside often see the argy-bargy of politics, on matters like this, it's good to see that we work closely together. He's a hard man not to have a problem with the member for Grey. I don't want to do him a disservice in his electorate, but he has been very strong on diabetes, and because he has an electorate that has those challenges, really brings great analysis to it. As stated by the member for Grey, there are now almost 1.2 million Australians diagnosed and living with type 2 diabetes. But there are others in our communities, likely to be around 500,000 with undiagnosed type 2 diabetes, and still another 2 million Australians who have pre-diabetes and at high risk of developing type 2 diabetes. So type 2 diabetes is a very serious and progressive metabolic condition. Many serious complications, including eye damage and blindness, foot problems, amputations, kidney damage, dialysis, heart attacks, heart failure and strokes. People with diabetes are 3 to 4 times more likely to have a heart attack or stroke. So a good disease to fight, a good disease to be an enemy of. And diabetes has a wider impact than those with the disease experiencing. Their family members, their friends, their teachers, employers all need to be aware of the support needed by sufferers. And the economic cost, which has been a big motivation for me, estimated to be nearly $15 billion annually. As well as being co-chair with this, I came to this because my mother had diabetes, type 2 diabetes. And it's funny, my mum's been dead for quite a while, but a few years now, but I always associate her with Canberra because I'd phone her often when I was here, away from my family, and Mum liked a bit of a chat. And this was, in fact, I've only ever stayed in Canberra twice in my life on a weekend, once with my mum and then the weekend just gone. So I was thinking of Mum. So it's great to be able to do this motion. I thank the member for Grey. Now, while we do not know exactly what causes type 2 diabetes, the good news is there is strong evidence that it is preventable. Obviously, it's a progressive condition, develops over a long period of time where the body becomes resistant to the normal effects of insulin, causes the pancreas to produce greater and greater amounts of insulin, and eventually the pancreas loses the ability to produce enough insulin to manage the blood glucose levels in the body, and then the cells in the pancreas are gradually destroyed. And it represents about 85 to 90% of all cases of diabetes in Australia, but there are some markers that make it more likely to determine if someone will develop type 2 diabetes if they're over 45, a family history of diabetes, if they're from some particular ethnic backgrounds, if they suffer from high blood pressure, or if they're overweight or obese. Many people who've developed type 2 diabetes have no symptoms at all. For some, the first sign might be a complication such as a heart attack or vision problems or a foot ulcer. There is no cure for type 2 diabetes. That's why prevention is crucial, and there is strong evidence that we can prevent it in up to 60% of cases, something that we are not achieving in Australia as yet. We do need a national type 2 diabetes prevention program to help prevent people developing type 2. This would include risk assessment, evidence-based lifestyle behaviour change programs for those that are high at risk, whole of community change to promote healthy eating, healthy physical activity and healthy weight, perhaps springboarding off our response to the pandemic, public education campaigns and public policy initiatives including reducing marketing and promotion of unhealthy food to children, reducing sugary drink consumption, reduced added sugar, fat and salt on the food supply, reduced cost of healthy food options for the poor and disadvantaged. A prevention workforce of health professionals trained and certified in diabetes risk assessment and prevention should be developed in each state and territory. A range of suitable health professionals from fields including nursing, dietetics, physiotherapy, exercise physiology, pharmacy, psychology and Aboriginal health workers should be included. The goal of any program would be to slow the growth of the obesity epidemic, the main driver of type 2 diabetes, and preventing low-risk individuals from moving into the higher risk category. If you develop type 2 diabetes, and eating well and exercise are very important management tools. It's important to keep the blood glucose levels in the target range to prevent short-term and long-term complications. Diabetes is an epidemic, not only in this country but across the world. We need to tackle diabetes head-on for all our sakes. I look forward to working with the member for Grey to doing so.